so excited today to have my friend Cristina Montoya, who has lived experience with rheumatoid arthritis and expertise in diet and nutrition for inflammatory arthritis. Thank you so much for being with me.
Thank you, Cheryl. I'm so happy to be back to this show, I
Yeah, I
guess.
think this is your third at least showing on this podcast. So I'll make sure to put the links to the previous episodes in the show notes. Can you let everyone know where you live and what is your relationship to arthritis in a nutshell?
Yeah, quickly, I have lived with rheumatoid arthritis and Sjogren's disease for more than 20 years. I specialize in anti-inflammatory nutrition, and I'm very passionate about helping women and most recently men with
Mhm.
rheumatic diseases transform their eating habits by really helping them creating arthritis friendly and gut healthy meals and promoting overall wellness without the need for restrictive diets. I am from Colombia, but I've been living in Canada for 18 years.
Yes. And, so for those who might be newer listeners, I've said this before, but I'm very, very picky about who I choose to come on the podcast to talk about the topic of diet and nutrition specifically, because there's a lot of misinformation out there, or there's incomplete information that people, subject matter experts, are kind of for lack of a better word, like myopically focusing on one part of the research and not looking at the overall breadth and not thinking about the patient's overall quality of life and just looking at nutrition in a vacuum. So that's something that I really love about your perspective, which it makes sense because you are a patient who has a lived experience, that you really are thinking about the big picture holistically of like what is the role of what is the role of nutrition in our quality of life? I'm already giving it away, but anyway, so I'm happy to have you on. And we refer to each other as RA twins because we were both diagnosed in the same year at around the same age. So can you tell us a little bit about your diagnosis story or quote unquote saga?
Oh, okay, let's see if I remember. But I was diagnosed with rheumatoid arthritis about like 20 years ago, and with Sjogren's syndrome, because that's how it was called back then. Now it's Sjogren's disease, thank God. I was my last year of nutrition in University of Antioquia in Colombia. And at that time, I was, you know, who expects to be in pain all day, all the time, and not being able to reach your professional goals. At that time, I didn't even have a boyfriend. So it was all these uncertainties, like what's going to happen to my life. And my mom had to literally treat me like a baby. She had to feed me, she had to dress me, she had to take me to the university so I could take my classes. And I look back and I said, my mom is my hero because she was always there for me. And I was at the same time diagnosed with Sjogren's disease, although that one started way earlier when I was 8 years old, but nobody really knew about it. And that one started with a lot of digestive issues, dry eyes, dry mouth, fatigue. I was the kid that no one picked for playing because I was always tired. So that was very sad. I couldn't really had the stamina to keep up with my peers. So I did grow up with an undiagnosed autoimmune disease. So but one thing that I learned though is that was 20 years ago. I suffered a lot of pain. I'm not experiencing that pain right now. So my takeaway is like even though RA is unpredictable, Sjogren's disease is unpredictable, even that excruciating pain is temporary in a way that we can learn how to live with it and thrive with those diseases.
That's a beautiful sentiment. And I mean, you've hit on when you use the word unpredictable or unpredictability and uncertainty, those are like the toughest parts of it that for me personally. But I think one of the things I've heard you reference before or that we've talked about before is the fact that like in my journey, I was put immediately on like biologics plus methotrexate, which put my disease into remission for a number of years or near remission for many years after that. Whereas you didn't have that same experience of like what they call early aggressive treatment with Western medicine. What would you want to share with the audience about that?
Yeah, that's correct. Actually, the onset of my rheumatoid arthritis was fairly quick. My symptoms started in, let's say, October, and it started with extremely like swollen fingers. They looked like sausages. I wasn't even able to hold a piece of paper. You probably remember those days. It was extremely painful. And by January, I was diagnosed with rheumatoid arthritis and immediately put under the care of rheumatologists in Colombia. So compared to some stories, right, that they take years to get diagnosed, it was very quick. And I was put in immediately in prednisone, I believe, and methotrexate right away. But it still didn't work. I unfortunately, that was around 2003. The biologics were not very common in Colombia, or rheumatologists were hesitant to prescribe it, and they're also very expensive. So only when I came to Canada 2007, by 2008, that's when I started the biologics. But at that time, the rheumatoid arthritis had already caused damage, and my joints were irreversibly damaged. Because once the rheumatoid arthritis attacks your joints, it's like forever, unfortunately. And so that's why I always highlight that each person's journey and experience is so unique to the person. And it's not our fault if certain treatment doesn't work for you. It's the disease. It's not you, it's the disease.
Yeah, that's so true. And I think, a lot of times when people are, in your case, you didn't have a choice, like let's say to try biologics or not at your immediate diagnosis. A lot of people today are given that choice, to maybe be more aggressive or more conservative. And this has come up many times in the podcast in the past, but people tend to really focus on the potential side effects of the medication versus the potential benefits of the medication. And of course, there are side effects, but the trade-off is that you are protecting your body from not only irreversible joint damage, but the systemic effects, on your other bodily tissues like heart, lungs, and just the inflammation that ravages, your body and makes you not feel good. It's particularly for fatigue and stuff like that. So I just think that it's important, like you said, everyone's journey is different. Someone else who is diagnosed at the same time as you in Colombia who might have had a less aggressive form of RA, because it's a progressive disease, like by definition. But for some people, that progression is very swift and severe, and other people it's slower and more mild. So some people with your same treatment plan might have done okay or not had irreversible joint damage until many more years, but you were in the camp of people who unfortunately had that more aggressive form. And that's not, like you said, it's no fault of your own. So I think that's really important for people to just think about. Like I'll say sometimes people are like, oh, they use the word like achieved, like you achieved remission. I'm like, I mean, I literally just injected myself once a week. Like, I don't feel like that's an achievement that has anything to do with what I did. Like, someone else who did that same injection once a week and that drug, quote unquote, they failed that drug. We did the same exact amount of effort and action. So why is one being seen as this, achievement and one as a failure? That's kind of silly, right?
Yeah, it makes you feel like, oh, I'm the winner, I did it, and I achieved this, and oh, but you're the loser because you didn't follow everything. You didn't do everything perfect, just the way I did it. And I think it's just it's so important to just take that guilt of the person. It's just this is not how it works. And I think for us, we have been navigating um this disease for so many years. And I personally have navigated also different healthcare systems where I know when I was diagnosed in Colombia, if we had access to the biologic, we actually had to fight the government to give us the biologic because they wouldn't fund it. In Canada, fortunately, I haven't had that struggle that I have to fight the insurance to give me the medications. I've always been consistent. So I'm very lucky. I'm speaking from my own experience, but I had never have to go through like an insurance company to say, look, are you giving me the biologic this month? Am I having access to it? Or I had to stop it and try a different drug because this insurance company doesn't have that coverage. I haven't had that experience in Canada, and I'm very, very fortunate to be here. And I love Canada, you know that.
Oh, I love it. I love it so much. That's so great. Yeah, and that's yeah, such a good point. That the navigating the healthcare system, that's can be its own episode for sure. But before we get to more of I'm excited to hear you share some of the biggest, takeaways and aha moments from the rheumatology conference back in November. But I want to just give you a quick minute to share what inspired you to become a registered dietitian? And maybe this is the one I just added, so let me know if this is okay. But like for people who maybe have never seen a dietitian, like what's it like to see one? Like what's an appointment with you like?
Well, as a registered dietitian, what inspired me is because I wanted to be better. I've been better at improving my eating disorder. I know it's kind of counteractive, but because of my Sjogren's, my undiagnosed Sjogren's, I will say, I struggled with a lot of food intolerances when I was a teenager. And I thought that the one way to control that was through food. That was the only thing I could control. So unfortunately, I developed an eating disorder. When I signed up when I applied to study nutrition and dietetics in Colombia, I actually wanted to be better and how can be better at dieting. And that was the reason I signed up to be a dietitian. And I was actually fortunate to find out that that wasn't the right journey or the right path I was taking. And the professors identified that I had an eating disorders, and they actually helped me to get some counseling with a psychologist. And also seeing that nutrition is not a it's not punishment. So being not well nourished is not about restriction or about punishing yourself because of things that you can't control or you don't understand. And so that's what actually when I fell in love with nutrition, and I started focusing more on the social programs that were designed to help people who actually needed food, like people experiencing household insecurity. And so instead of, so I kind of went from restricting food to actually finding ways to contribute to feed the people who needed it the most in Colombia. So that's how I fell in love with nutrition in Colombia.
Wow, that's a really inspiring story. And first of all, thank you for sharing about, your disordered eating history because it is so common for people who have health issues to develop disordered eating, whether it's again like a coping mechanism for symptom control or like in my case, like I had gastroparesis and I started restricting my diet because I could just tell that like, and it didn't fall under the threshold of an eating disorder, but I was just trying to figure out like, why do I feel so bad every time I eat?
Mhm.
Like, and what is there something I can eat that would make me not feel as bad? But it's like for many people, it can be a slippery slope. And you mentioned control, and it's just so important to recognize that like there is so much that feels like out of control, especially when you're undiagnosed. But even when you are diagnosed, it's like, of course, you would want to control something that gives you a sense of agency and confidence in your life. And so, and I think, well done to your professors for recommending you see a psychologist, and well done for you well done to you for being amenable to their suggestions. I know that eating disorders are one of the most difficult mental health conditions to treat, just in terms of it's very, very hard from what I remember learning that at school. I don't know what the right way to say it is, but it's like they're very um, intractable at times. Like takes many, many, many years to unlearn those restrictive patterns.
It's true. It's a disorder eating. I started experiencing bulimia when I had like all the binges and hiding from people what I was eating when I had all these binges of food. And then the way I will do is like I will just go and exercise for like 3 hours at a time. But that is slowly started to become into anorexia. And I was extremely like becoming so weak. And at that point, I hit rock bottom when I had to be hospitalized for extreme weakness and dehydration. And so that was like a trial at the beginning of my, when I started my nutrition career. And so that's when I realized, okay, so I want to live. And somehow when I was diagnosed with rheumatoid arthritis, and it helped me heal. I don't know, for some reason, it really helped me to stop preoccupying myself for how I look or what the mirror is telling me, and more about, okay, I need to move. I don't want to feel pain. So somehow, maybe it replaced that situation, but it helped me heal that part of me
Yeah.
that it was also hurting me.
Mm-hmm.
Yeah, now when I think back, it happened that is that now I have rheumatoid arthritis. I need to eat well. If I have to, if I need the energy to go and graduate with my classmates. I don't want to be left behind. I want to graduate, so I need to eat. That was my thinking.
Yeah. And so were you diagnosed with RA during your schoolwork for being a registered dietitian?
Yeah, so I was on
Okay.
my final year, my
Okay,
final.
I wasn't sure if it was like a separate program. Okay, yeah, that's a lot. I mean, I was diagnosed right before my senior year of my undergraduate, so which was definitely hard, but my master's was even harder. Like in the terms of that would have been really. Anyway, it's not suffering Olympics, but it's just yeah, that's I think in my little perspective from I don't know if this is the same thing you're talking about, but I feel like the worries I used to have aesthetically about my body, like I still occasionally get them. Like, especially if you do videos, you're like, oh my gosh, is that what my mouth looks like when I talk? Or like, is that what my nose looks like? Whatever, we all have that. But I feel like I stopped seeing my body as aesthetically important, and it just completely focused to like health. Like I don't care
Mhm.
how ugly, quote unquote, I might look. I want, as long as I can, if I can, I'd rather trade looking pretty or looking whatever, looking sexy or something. I'd rather feel healthy than look good. You know what I mean? So I feel like there's a utilitarian almost part, which you're almost like, okay, looking pretty is like icing on the cake, but first I want to feel not in pain. Does that make sense?
Yeah, well, it completely makes sense, especially in Colombia, you have that pressure, or Latin America, all the Latin American women have to be gorgeous and have to be like well proportioned, whatever that means. And
Hmm.
so it's all this pressure on body image that when I was diagnosed with rheumatoid arthritis, that was like just honestly, I didn't really care for it. Like I don't care if I gain a little bit of weight
Me
because I'm
too.
expecting that weight gain because I was on high doses of prednisone. And so I needed to really balance all those messages or those internal messages and say, okay, what is the priority? What is going to really nourish my body? What is going to help me to survive and to thrive? I'm only 21 years old. I believe I was 21 years old, right? I'm now 43. And
Mm-hmm.
I'm very blessed to say, hey, I still have another maybe 20, 30 years ahead of me. And because I took the necessary steps and I committed to the treatment, I committed to changes in my life, that I was able to survive all these 20 years. And I'm hoping to maybe go another 20.
Yeah. Yeah. I love that. Yeah, we were both diagnosed at 21 and we're both 43 now, which is like another twin thing. So I love it. Well, and I want to actually this really dovetails nicely like to, I want to use some of our time to separate the fact from fiction when it comes to nutrition for rheumatic disease. And there's just so much misinformation out there. And we've, in previous episodes, also tried to demystify and provide clarity on some of these things. But, starting with the 2024 American College of Rheumatology multidisciplinary conference, what are some of the latest kind of evidence-based or emerging evidence areas that you find most exciting or interesting to share with the audience about the role of nutrition in rheumatic disease?
I really wanted to share this with you. So, well, first, I was very excited to be part of the our panel that It's
Oh,
Not
yes.
Just Joint Pain,
Mm-hmm.
which I had really the privilege to be with you and Eileen, Chronic Eileen, and so many other experts. And I was given that opportunity to speak about nutrition, the role of nutrition. and rheumatic diseases. And then we know literally, like we know that the role of rheumatic diseases is to it's not very clear, to be honest. There are some research that has shown that, especially for rheumatoid arthritis, like the Mediterranean diet has helped to reduce pain and improve vitality. But I went back to one session that caught my attention. It was by Dr. Monica Goma, and she talked about foods that fight inflammation. And the focus actually was on the importance of the gut microbiome in modulated inflammation and rheumatoid arthritis, or the potential role. And how she started the presentation, I really like, is because the questions that patients have about diet, they change depending on the stage of their disease. So at diagnosis, they will come and say and ask the rheumatologist, should I consider changing my diet, or what type of diet do you recommend? Then you hit that the low activity disease, you're still a little bit of pain there, but I'm taking a lot of medications. So do you think if I change my diet, I can reduce the number of medications that I'm taking? And then once the person reached remission, they said, well, I'm feeling great. Can I just stop the medication? And what is the diet that's going to make me feel better? So I really liked how she started with that, because that's exactly what I get when I work with my clients. It's like, what diet do you recommend for my rheumatoid arthritis? And so I agree with this, that a healthy, balanced diet is essential to improve and then an improvement of the lifestyle is very helpful with individuals with rheumatoid arthritis. They help them like have weight control, right? So they help us to improve our cardiovascular parameters or prevent cardiovascular diseases. Because one thing that we're learning, and is this connection with inflammatory arthritis and cardiology, right, or cardiovascular diseases, is that even rheumatoid arthritis is an independent risk factor of developing cardiovascular diseases. So if we go back to the Mediterranean diet and the lifestyle, that is the number one diet that is helping to prevent cardiovascular events, that's where we can find that connection. That it supports the management of inflammatory arthritis, and also the prevention of complications like cardiovascular diseases. Maybe that makes sense.
Yeah, that does. And I think that's something I don't think I learned that like until maybe 10 years after my diagnosis, that there was this relationship between rheumatoid arthritis and cardiovascular diseases, and heart disease overall, things like, having a stroke. Like, when we say cardiovascular events, these are not like like little things. Like, these are like,
Yeah.
stroke, a blood clot, whatever, all just what's the thing where the buildup of the plaques in your vessels. I forget what that's called. Whatever, all the bad stuff. You want to do what you can to avoid that. And so I think that's such a good point. A lot of people think of maybe there's some magical relationship in their head between like the foods they eat, and that those foods are like making their joints feel better, but they also are really actually helping your health, your heart health, and in the same way the exercise does too.
Exactly. And I think the second point that she pointed out is that, okay, people with rheumatic diseases, they should be informed that consuming specific foods, it's unlikely to have like huge benefits to their rheumatic disease outcomes. And I know a lot of people don't want to hear that. And these are the reasons why. Diet-related studies or nutrition-related studies are very, very difficult to conduct and to blind. So if you're thinking about like a drug clinical trial, that either you get a placebo, you get the drug that they're studying, but they are giving them a specific dose. It is nearly impossible to do that with nutrition, because when you go into nutrition studies, they are relying like a 24-hour food recalls to really assess what you ate in the past 24 hours. So that really relies on memory. It relies on trust that participant is gonna tell you what they ate, because they say, okay, no, we're gonna run a study with just I don't know, maybe the anti-inflammatory or autoimmune protocol, and you need to restrict nightshades for 3 months, right? So nightshades including tomatoes, eggplants, potatoes, and you will say, okay, so let's say they'll have to give you the same food every single day. And are you telling me that you eat the same foods every single day?
Right, right.
So there is a high like risk of bias in that situation. So with the participants, they are very good and they're trying really their best to follow the guidelines. But sometimes there were like cost restrictions, and everybody has the money to maybe buy or eat salmon twice a week. Or maybe the day before they decided that they went out with their friends and they didn't eat that salmon during that study, but they're afraid to tell the researcher because it's shameful to say, oh, I didn't follow the protocol. And so these are just examples tell you how difficult it is to study nutrition because there's so many confounders. So they could be that inconsistency, there is it's very indirect, that is very difficult to truly measure the effects of the nutrition interventions. And most of these studies really don't run more than maybe 6 months, maybe they do a follow-up, maybe a year follow-up. So many times there are publication biases because they might be run with a specific interest, maybe it might be a specific company that wants to promote a specific product. So it's really just kind of keep that in mind when you are reading a nutrition article or a research, or many times they will say, oh, the such diet, a ketogenic diet showed some results in patients with rheumatoid arthritis. When you look down at the methodology, they say, well, it only affected maybe 2 or 3 people, showed positive results. Then on top of that, you want to be ethical when you're running nutrition or diet-related studies. All the patients are under medications. The researchers are never going to tell these patients, you have to stop the medication so then we can see the outcomes of this trial. That will be unethical.
Right.
Oh, sorry, I just kind of went there.
Oh no, and this has to go with this is really not even only specific to diet, but diet's just and nutrition is like a magnified example of just the overall some issues in health literacy when it comes to patients trying to do their best to do quote unquote do your own research, and that's really important. Like no one would say you should never research your own disease, but you need to understand how to make sense of scientific journal articles and avoid pitfalls, things like cherry picking data. Just because there is a piece of evidence in one journal article does not mean that that is conclusive. You know, there was just to use a different example from nutrition, I follow this OBGYN who is called Dr. Jen Gunter, and she's really great at like busting myths about she wrote a book called The Menopause Manifesto, and she posted an example where a first author on an article is about menopause and hormones. And this is another really tricky area like autoimmunity where there's so many variables that are hard to control for. And this first author on one of these studies, which showed there was some relationship between testosterone and improving symptoms in people with menopause, that was never replicated. So, but the influencer who doesn't have any scientific training and understanding of this to look at the breadth of research, she was like, well, you guys should tell your doctors that you need testosterone therapy because here's an article. She's doing, in her mind, she's looking at evidence. But the lady who wrote the article, it's like, evidence is not just about cherry picking one study. There were like 9 other studies that could not replicate my finding. So sometimes the findings are due to chance. They're just, or there's some underlying variable that was influencing the results that you just don't know till later. So everything is complicated in conclusion.
Yeah, and I think that's what I always talk to. And when I get a client and they want to change their diet, and I say like, when I ask them like, are you being seen by a rheumatologist? First of all, are
Mhm.
you getting treatment for rheumatoid arthritis? And second of all, I just don't want to give you like the 10 most anti-inflammatory foods, and we have to look at what is your lifestyle, what is in your life, what's going on. And I'll give you an example. So, like I said, I promote my business for women, but somehow I'm getting more men. And the reason I started to take in more kind of male clients is because the shame that sometimes they experience. And I said they're afraid of saying I'm in pain or I can't provide for my family. So anyway, so I was really I was seeing this specific client that wanted to lose weight and was very committed to make the changes. And they wanted this just the diet. But you know what we went through actually? We went through a journey of seeing what was the lifestyle. So one of the things was, no, I only drink a cup of coffee in the morning and maybe a granola bar for lunch. And then I have a huge dinner when I come home, and an hour later I go to bed. So do you see anything wrong in that scenario? Well, what do you see in that
I
scenario?
remember learning you did talk about this at the conference at the It's Not Just Joint Pain talk about if you have a huge amount to eat before you go to sleep, that is not helpful for your sleep quality. And overall for your blood sugar, that's not good to just eat one huge meal, right? Or you can tell more than me.
And that's the thing. It's like, and it was not just about not that they just one large meal, but it was just the choices throughout the day that they could be that yes, there are foods that have the evidence that can be pro-inflammatory, right? Like the highly processed foods and a high refined sugars, saturated fats. And when I started maybe highlighting those areas that were concerned and that can actually be specific, there was a high intake of sodium, even over like 5,000 milligrams of sodium a day, which, the guidelines is less than 2,000 milligrams. The same thing for saturated fats. It was like a 300% over what the requirements were. And also a high intake of carbohydrates and simple carbohydrates. So that's when a registered dietitian really comes in and starts to dissect your lifestyle and your eating habits and really start targeting, okay, what is it that is going to make the most like an impact in your lifestyle? Because chances are it's almost like going to the gym in January. You see the gym in January completely full. So when but you go in February, March, numbers starts to kind of dwindle. So the same thing happens when you're trying to make a dietary change overnight, because we eat every single day. So you want to make sure that the changes that you make, they're very gradual and they become so like kind of common sense that over the course of like the weeks, I said, oh no, I'm not just having a cup of coffee. I'm actually having a bowl of oatmeal with nuts and blueberries, and I'm actually feeling better. I'm more energized, and I don't think I can have that only cup of coffee. Do you want to get to that stage where you just feel that you want to do it? Not just because you have to do this, because I have to follow this meal plan. We know, dietitians know that whenever we give a meal plan to a person, they never follow it.
It's the
They
same with
never
a
do.
It's the same with a home exercise program for PT, especially if the caveat there is at least what I was taught as an occupational therapist is that if you just hand them a sheet of paper without talking about it or customizing it to them, obviously it's not relevant, right? But if you can work collaboratively together with the client or the patient, I'm sure you do that as a dietitian too. Like what feels doable to you, versus, oh, here's this prescription approach. Like there really is no one size fits all. It's going to be like an iterative process. And your registered dietitian is like an important team member if you want to pursue improving your quality of life with rheumatic disease through nutrition. It's not much harder to do it on your own.
It's that's the thing. Is so almost sometimes we come and I see clients where they want that permission because they're so overwhelmed with all the information online and from credible sources, right? So you have this the doctor who wrote the plant paradox and it has a protocol and eat lots of plants and some people they can just take eating all these plants and they feel guilty. But I used to enjoy, like a steak on my husband's birthday or a little bit of cake on my birthday on my kid's birthday. And but if I eat it, I feel so guilty that I didn't follow that protocols. I'm being bad. And that's why things are not working. And so my approach is always about really compassion. And I said, like, wait a minute, you're already having a very hard time to adjust and to live with a chronic disease that is incurable and unpredictable. So give yourself a little bit of some a break
Yeah.
and enjoy too, right? Like that's meaningful to you to have a little bit piece of steak. It's okay when everything else is going well. You're adding more plants into your diet. You're being more consistent with your meals. You're getting yourself more hydrated. You're starting to move. It's just not about the specific food. It's about the change in your overall lifestyle. And I think this is what I really wanted to highlight, something that I shared in one of my webinars. So as you mentioned earlier, I realized by doing this is that I've been contributing to the Arthritis Society Canada Norwich program. You just go onto their website on arthritis.ca, and I've been contributing to their program in terms of anti-inflammatory recipes, articles, webinars for the past 5 years. And I feel very honored because then they trust my opinion, they trust my knowledge, and because I don't give any promises to patients because I haven't seen that cure. I'm very responsible to what I say to my clients, and I'm very honest.
Yes, me too. Yeah. Yeah.
Um, so this is what I wanted to share with you because sometimes when you look at and people think about the Mediterranean diet, it's like, oh my God, you're talking about the Mediterranean diet again, and I don't want to eat hummus every day, and it's like okay, because when you think about the Mediterranean diet, you're thinking that you're eating like I don't know how they eat in Italy, but the Mediterranean diet covers so many different cuisines, right? It covers from all the Mediterranean basin it goes from Portugal, Spain, even all the way to Turkey. So it's just a variety of foods. But the main goal of the Mediterranean diet that I support is that it's a plant-focused dietary pattern. And we know that includes all whole grains and nuts and seeds, fruits and vegetables, lean proteins. But the one thing what we tend to not focus is that the Mediterranean diet is also that lifestyle. So the diet emphasizes on the physical activity, socialization, and even cooking with your family, cooking with others. It's a celebration of food. It's a celebration of your culture and life and family. And on top of that, of course, it is rich in antioxidants and anti-inflammatory compounds and can be adapted to various cultures. So in my case, I'm Colombian and I hated olive oil. I honestly hated it. I didn't like it at all. It took me many years to finally embrace the flavor of olive oil, and it's okay, right? It's okay. So instead
Yeah.
of using palm oil, then I said, now I love olive oil. If I'm eating arepa, like the corn kind of bread that we eat in Colombia, instead of butter, I use olive oil and I love it. So it takes time to adapt.
Yeah, I just had someone in one of my Room to Thrive support groups who was saying it was really a grieving process for her of trying, like, she felt that, or she assumed that she was going to have to stop eating all of her favorite foods, and she's Mexican. And she's like, I can't find any overlap between the foods I eat and Mediterranean except for corn as a plant, technically. But I'm laughing, but it's just like, I got tomatoes, you got, red meat, all this stuff. And I think that's really important. I mean, sorry, overall, what you're saying about the Mediterranean, what is it about the Mediterranean quote unquote diet? Is it really the Mediterranean diet or is it the Mediterranean lifestyle? Like you mentioned, is it that they're walking more? Is it that your food is fresh and less processed? What is the context? Are you sitting down, mindfully eating with your family? Is it stress management? Is that all contributing? And stopping, it's important, I think, at least in my experience, to not look at food as the same as like medicine, where it's just what's inside that pill, but it's what's the overall context that you're eating that food in. How do you feel about it? To me is huge. So anyway, I'm just preaching, you're preaching to the choir here. I think it's such a beautiful point.
No, but it's I think I like the fact that like how you summarize and kind of making sense, right? From the patient perspective, like what can you see? And when you look into more, let's say, let's go into more like a chemical, what is the importance of the Mediterranean diet in gut diversity? And so it kind of went over like about that, but we learned about that connection with modulating the gut microbiome to improve or to reduce inflammation. So the Mediterranean diet, because it's so rich in fresh fruits and vegetables, it's rich in polyphenols and plants like flavonoids. They have antioxidant, anti-inflammatory properties, and they actually affect the gut microbiota and immune system. They reduce inflammation and they also promote like a beneficial bacteria. These flavonoids and also fibers and prebiotics, what, when they go to the gut, there's this little bugs that they love that fiber and they produce that short chain fatty acids that they're the main source of fuel for the gut barrier to maintain a gut barrier. Um, no, and I'm not going to say that leaky gut. No, like everybody experiences a little bit of leaky gut at some point in their daily life, but it's just the importance of maintaining that gut barrier and cell function, immune cell function within the gut because it holds up to 70% of the immune cells. So you see, when you kind of started to analyze and see what are the benefits of the Mediterranean diet, and you kind of bring it down to your gut, literally, you start seeing why more consciously as to why I should really eat that. If we are modulating inflammation from the gut, it is possible that I'm also helping to enhance perhaps enhance the effect of the medications that I'm taking.
Mm.
Also, the Mediterranean diet it's also full with antioxidant foods like vitamin C, vitamin E, omega-3s, right? That we know that that's a very important nutrient for to reduce inflammation. And it really promotes what we have seen from the gut health perspective, that we eat more than 30 plants a week, and plants counted as anything from nuts and seeds, whole grains, fruits and vegetables, that all counts as plants. So this is why they all goes back, any anti-inflammatory eating pattern, it it stems from the Mediterranean diet.
Hmm. I really love how you're breaking it down because I think, yeah, when I have seen educational blurbs about the Mediterranean diet, it's often just like, here's, like you mentioned, here's a list. You should eat olive oil, you should eat lean meats, you should eat these, hummus, like you mentioned. And it doesn't go to that next level of what is it that those foods are doing. And I think if you understand the why and of it, then you're more likely to buy in to making a change towards that eating pattern that's going to work. And also, again, I mean, maybe just reiterating the role of the overall lifestyle, and kind of behaviors around eating that, I know I am the first to admit that in, American culture, we're kind of known for eating on the go and, grabbing something, eating it in the car, and not having a real like sense of, I'm having a nourishing experience with when I'm eating. So anyway, I find that really just helpful to understand what's maybe going on. And I think, do you think that there's going to be, this is totally off the cuff question, but in the next, I feel like this is just a premonition then based on evidence I've seen, but I'm not as in deeply into it as you are, but in the next 5 to 10 years, there's going to be like a massive increase in the understanding of the role of the gut microbiome in autoimmune diseases in general.
I would say like a massive. I think they're still very confused and they don't
Yeah.
truly understand the results. But I
Right.
what I do see is that is being acknowledged and is
Mm,
being studied. So for the and this is so important to know because even if the person feels and follows the, let's say, quote unquote perfect Mediterranean diet and lifestyle, and or two people, let's say you and I start eating the same Mediterranean diet, but our gut microbiota is completely different, right?
mhm.
So those foods are going to react also differently
Yeah.
to what we eat. So what they say is that with the doctor Kuma, she said that this diet, like specifically the Mediterranean diet, will increase the pool of anti-inflammatory metabolites compared to the Western diet. So the one that you're just describing, right? The things that are on the go, fast foods, and so. But so the question she asked, so why don't we simply change the diet and they will get better if we know that these foods have anti-inflammatory metabolites? So then she describes, so well, unfortunately, the gut microbiome doesn't only depend on diet. The diet is only one piece of that puzzle that shape the gut microbiome. So there are other factors that we have in that we cannot change, which is age, genetics, past medical history, perhaps infection, environment, drugs
Mm,
or antibiotics, right? Those are things that we can't
wow.
change. So until like we understand how we with how the gut microbiome really it really depends on so many factors. I think that's the key. I think that's what they're trying to understand. And uh so yeah, I think that was very powerful.
Yeah, I love that. And I think, I know we've mentioned this before, but like for me, I have another confounding variable or a condition like gastroparesis or decreased GI motility. That means that certain things that are recommended in the Mediterranean diet, my body doesn't respond well to, and especially insoluble fiber in the form of like beans, like legumes. I do not do well with them currently. My body might change in the future. But so things have to be, again, we can say it a million times, silver blue in the face, but if there's no one size fits all, really. But I love thinking about I actually had never really thought of the gut microbiome as being so influenced by things outside of the foods that you're eating. And actually realized we didn't even define what is the gut microbiome. Can you tell people who they might not have heard of this before? Sorry. I try to always
So
define our terms.
yeah, just the layman's terms, so the gut microbiome is like comprised of all the trillions of like bacteria and microorganisms. Really, it's not just bacteria, but yeast, and they're mostly located like found in the gut, but also the skin. Like the skin also has like their own like kind of microbiome. But in terms of all the research that is being done here, especially in rheumatology and the gut, they call it the gut joint axis related research. It is focused on all these bugs that we have in the gut, in the large intestine. That's kind of what it refers to.
Yeah,
Uh,
that's so helpful. Sorry. Yeah. I'm gonna also link in the show notes to I had a dentist who goes as like she's an integrative dentist, which I had never even heard of that being a field before, but she talked about your oral microbiome, and that was
yeah.
something, yeah. And I'm sure for you, even more important when you have Sjogren's as well, understanding the what's going on in your mouth. But people with RA themselves, we are much more likely to have dental disease, gum disease, and stuff like that. And just there is a whole set of bacteria living in your mouth, which like freaks me out as I think about it. But
No, and it's so great that you bring this up because that's really how aside from the skin, right? Like as kind of the first kind of barrier of protection, but like the mouth is really the door to everything when you're eating your food. That in if the we have like this pool of bacteria also both harmful and beneficial. You're eating your food, like you're kind of bringing all that down. And like you
yeah.
mentioned, if you don't consider a past medical history, if someone is not, maybe is taking medications to reduce the gastric acid, then you are kind of consuming those bacteria that the gastric acid is supposed to kill, then you're actually generating maybe or you're creating another problem. So being really conscious of what we're eating and how we're feeding that microbiota from our mouths all the way to our our gut, it's very important. And for Sjogren's disease specifically, there's a specific bacteria that causes cavities, and the cavities are like just below like the gum line, which is
Oh,
very specific. So our cavities, and it's the strangest thing. When I get cavities, it's like in the gum line. They're not really on the surface. They're right here.
wow. Wow. That's
And
so
they're very, very painful to treat because it's like how, and then you don't have enough saliva to really sustain and to continuously repair and to wash off that bacteria. So that's why Sjogren's disease is like so important to maintain that oral care. It's just paramount if you don't want to lose your teeth or if you don't want to, if you want
yeah.
to improve your quality of life.
Yeah.
But another thing that I really wanted to share with you when it comes to these gut and joint axis, where they do most of the research is with patients who are actually diagnosed with ankylosing spondylitis. Those with spondylitis arthritis, if I said it right, so it's the
Spondyloarthritis. Yeah. Yeah.
arthritis, there you go,
Yeah.
spondyloarthritis. So those patients are actually up to 20% of them can develop inflammatory bowel disease or some intestinal disease. So when it comes to researching really the connection between like gut and joint, they take the pool of patients with spondyloarthritis because they're just so close, right? The spine so close to the gut. So they have actually seen that the gut microbiome could be modified in so many ways. They have seen that many autoimmune diseases is dysbiosis, so there's this alteration of the gut microbiota, right? Where we have more kind of harmful bacteria and less beneficial bacteria. And they have seen that in individuals who have not been diagnosed yet. When they're diagnosed, they say, oh, there's gut dysbiosis here. When they start methotrexate, they start to balance the gut diversity.
Wow.
And so that was just it's so interesting. So there is this article where they say that they showed that methotrexate, it's an anti-inflammatory drug designed to target human cells. They actually can modify of the activity of certain gut bacteria. In sulfasalazine, which was initially developed like to treat rheumatoid arthritis, I think it's just now more used in spondyloarthritis, but they see that they promote the microbiome butyrate production. What that means is that, like I mentioned before, when we also increase the amount of fiber that we take, that also is going to lead to more production of short chain fatty acids, which is going to help to maintain that gut barrier. But you can also see that from certain medications like methotrexate and sulfasalazine that helps with that gut to improve the gut diversity, which is really interesting. I was just fascinated by it.
Oh my gosh, that's why I have a gut feeling, pun intended, now that there's going to be a lot more, if nothing else, just correlational evidence, but hopefully there'll be more causal evidence of like what can we, what are the even more tailored or targeted like nutrition choices we can make that really have that good influence on the gut microbiome and our overall disease. Those of you who are watching this on video, you'll have the benefit of seeing Teddy be really cute right now in my office day bed, which is part of my rest and sleep intervention for my quality of life with rheumatoid arthritis. Is there anything else you wanted to share about, nutrition facts, myths that you want to bust? Anything else? I know I want to just be respectful of your time as well, but
No, I appreciate. I think I want to go back to the busting some of these myths, and I was sharing with you earlier, that I started posting more in Spanish because I identified that there's also a huge gap in knowledge and information. And I feel like to that 2025 is the era of misinformation. Even in Canada, the Medical Association, Canadian Medical Association found that up to 30% of individuals in Canada are avoiding or stopping treatment because of misinformation. And that's huge. It's like a 1 in 3 people
so
are doing this.
sad. Yeah.
And so obviously now we are not really, we are also a huge target, right? That to get all because there's no cure, then we're so hopeful that the one protocol, that diet is going to cure us. So I want to kind of highlight a few of them. So some people say, oh, a carnivore diet cures autoimmune diseases. Okay, so when we just talk about the benefits of having more diversity and plants to improve our gut microbiome and potentially reduce inflammation. So we just go for a carnivore diet. You are removing grains, legumes, nuts, and seeds, and so many others that really contradicts the benefits of a plant-based diet. You also, in the long run, we're going to have a higher intake of saturated fats, there is strong evidence suggesting that it does increase inflammation and also increases the risk of cardiovascular disease.
Well, and can I say the word I remembered? Atherosclerosis. That's the disease
Yeah.
where you get the plaques, and it occurs when fat, cholesterol, and other substances build up in the walls of the arteries, forming plaques. That's the one I was trying to remember. Sorry.
And actually, that's very fitting because that's what the carnivore diet is going to lead to if you consume all these extra saturated fats, and
Yeah,
right?
that's what it made me think of it. I was like, oh yeah, I remember the word.
The other one is like gluten-free diets for all, right? And it's very clear that a gluten-free diet, it is the only treatment for individuals with celiac disease. That's very clear. But then we need to really assess. There's such thing that is a non-celiac gluten wheat sensitivity that we have, but we're still struggling to diagnose that, right? And there are people who do respond to maybe a low gluten diet or a gluten-free diet. But before going into that, please make sure that you get at least rule out the celiac disease, because that's another autoimmune disease. And then we are known to collect autoimmune diseases. So before you do that, make sure that you got that rule out. There was something very interesting though when I was preparing for a webinar that I did for the Arthritis Society Canada on gluten and arthritis. There was a review of case reports from Spain that suggested that individuals with fibromyalgia and spondyloarthritis who have experienced fatigue, oral candidiasis or oral yeast, GI or gastrointestinal symptoms, iron deficiency anemia, and a relative with celiac disease actually benefit from a gluten-free diet, which I thought that was quite interesting. But it was like a summary when they had all these conditions. They said, well, okay, maybe a gluten-free diet will work for you.
Yeah.
And it's also in the literature also tell us that Sjogren's disease have a higher prevalence of non-celiac gluten wheat sensitivity and also celiac disease compared to the general population and even compared to other individuals with other rheumatic diseases. And that's why it's so important to have your registered dietitian to kind of break that down for you, and then you just don't go in a rabbit hole.
Yeah, and I really agree with that. And I think there's also a difference between a dietary change that you might just through your own trial and error discover, like, oh, when I eat, as people tell me sometimes, when I eat gluten, I feel joint pain or swelling afterwards. that's helpful information for your body. And even if you don't actually have, it's not really doing a bunch of horrible things to you on like the cellular level or to your disease to eat gluten. If you feel better and when you don't, there's no reason not to. But there are many people who don't have that experience. Like I personally, I went gluten-free to help with my GI motility, and I was hopeful it would also help with my RA. It had like literally no effect. And so just like know that it's not, it's weird that people focus, in my opinion, the evidence is so much smaller than people's focus on gluten. And I think my assessment is that it's just because, again, we're driven towards finding something we can control. If it works for you, it's great. But if not, then you don't need to. There's nothing inherently unhealthy, quote unquote, or inflammatory, quote unquote, about gluten that's across the board for everyone. It's just individual bodies respond differently. That's my opinion or
Oh,
thought.
and have you heard how people say, "Oh, but I traveled to Europe and Italy and I ate like I ate gluten there and it didn't affect me." And so it's about so some of the dietitians were started talking about this gluten kind of dilemma in some of the patients, and I said, "Well, okay, so in Canada, like Canada is like a one of the major producers of wheat in the world." And but one thing what's interesting is like there are kind of two types of gluten. So we have the soft gluten. So there's like the wheat that contains kind of maybe less gluten. And then we have the hard gluten, which is kind of preferred for pastas and all that. Apparently in Europe, they tend to use more the soft gluten. It doesn't mean that it doesn't take the gluten away, it's still there. But isn't when you go to Italy, you just go to relax, to take your mind off work, and then but they know it's the food. And it's like, no, maybe you're just in a different state of mind that is helping just to reduce inflammation overall from what you're doing, right? So it's just that
Yeah.
correlation that we're talking about. Oh, no, it's the gluten. It's like, no, it's everything else.
But it reminds me of also like I was talking to Dr. Yu about this once, and I was like, it's mind-boggling to me sometimes how there are so many different diets that work for different individuals, and they seem opposites in my head, like vegan for one and carnivore for the other. And then he said, well, interestingly, there is a similarity between those. And I was like, really? Because this was like 5 years ago or 4 years ago. And he's like, well, they both, it's what are they both cutting out? Like they're both cutting out highly processed foods, and they're more both more straight up whole foods in a way. I mean, if you consider meat, this is like a whole food. And I was like, oh, that's so interesting. So sometimes it's not what it is that you are eating, it's what you're not. You're avoiding the and not necessarily carnivore is not recommended for RA, or for just overall heart health or just anyone, unless you just, yeah. But it's just interesting, like when you're trying to do that detective work to figure out like why does this make sense? It's not just what you are eating, it's what you're not. So sorry. So you have the myths about carnivore, myths about gluten. Any?
And I want to share this one because I just couldn't take it. When one of my clients wanted to work with a dietitian and she asked for a referral to a doctor. And so I want to see a dietitian because I'm having a lot of gastrointestinal issues. I live with Sjogren's disease, and the doctor told her a dietitian is only for fat people. And it literally that's how she was told.
Oh my gosh, I've never heard that.
Yeah. I couldn't believe it. And then so I remember saying, hey, well, Sjogren's, for instance, and compared to other rheumatic diseases, can actually affect your entire gastrointestinal tract from gum to bum. That's how I say it. And so a dietitian can help providing guidance on diet modifications to ease that discomfort related to dry mouth, chewing, and swallowing difficulties. It helps to help you with heartburn, gastroparesis, right? That chronic constipation or diarrhea, and also develop strategies to prevent unexplained weight loss that actually happens in Sjogren's. There's a lot of weight loss and nutritional deficiencies. And so that's why I'm such a huge advocate for individuals with Sjogren's, because it really goes beyond the dryness. And this is how I told her to respond to that doctor. I said, no, a dietitian is more than the weight loss. And initially I said I didn't want to work with weight loss and obesity because it's almost like a stigma that is attached to dietitians that it only works for people for weight loss.
Mm-hmm. That's so important. It's almost like it almost reminds me of like a misconception I had, which is I actually thought before I went to mental health therapy that therapists are only for people with like extremely, what would you call them? Like very severe mental illnesses versus I didn't think I could just get help with anxiety. In my head, I'm like, but it's not like I'm leaving the house. It's not like I have severe OCD or something, you know? And it's like sometimes it's like hard to remind yourself that these resources are for anyone who's struggling, you know? And it's up to the provider, like whether it's a mental health provider, they're not allowed to like charge insurance for just like seeing people who don't have any sort of issues at all, but there's a huge spectrum. Anyway, so but this has been so helpful. And I have a couple rapid fire questions. I'm not going to ask all of them. Do you have time for a few?
Yeah, I have it now.
Okay, perfect. So I think this is so chock full of helpful information. So I really appreciate it. What are your just overall, whether it's about nutrition or just kind of, you know, basics, what is your best advice or words of wisdom to somebody who might be newly diagnosed with either rheumatoid arthritis or Sjogren's disease, like today?
I acknowledge that being diagnosed with a rheumatic disease is incredibly challenging and life-changing. However, compared to 20 years ago, there is now greater awareness, more advanced therapies, and a stronger support systems available. So it's essential to remain vigilant and avoid individuals who promise miracle cures.
Yeah.
Um, I think that's what it is, that we need to really go and hold on to what is the evidence. Hold into support systems, like just like the support groups that you run, which is amazing because you know that you are providing like evidence-based information. And then because that's your motto, that's what patients are expecting from your support group, right?
Right. Right. Yeah.
So this is what I see. Don't let because some kind of cure, promising a cure, it's gonna get you to, damage your joints, your organs. It's not worth
Mm.
it because then it will be very difficult to correct that.
Yeah, one thing we both talked about before is like the importance of a both and versus an either or when it comes to Western medicine and complementary or lifestyle interventions. You know, it's most people who have rheumatoid arthritis statistically require both the vast majority, whether you look at the studies that say 80%, whether you look at the studies that say 90, 95%, there's different studies depending on how they define things, but the majority of people with rheumatoid arthritis require medication to sustain remission. That's just a fact. So having a both and mindset of, okay, I can take medication and let's maximize my diet. See whether maybe a realistic goal instead of being like a medication-free remission could be reducing medications or going from 2 to 1. That's something that a lot is more achievable than saying I'm just going to only control this with nutrition and lifestyle. And that's just, and I'm saying that I actually have a vested interest in people doing the non-medicinal things because I'm not a doctor. I don't have any skin in the game in terms of, and I'm saying this as somebody who it would be a better business thing for me to say, all you have to do is take Room to Thrive, and I'm going to teach you all the stuff so you
Yeah,
can get off of all those scary medicines.
exactly.
Yeah, but like, and you're the same as a dietitian, you'd be like, oh, you just need to do diet, and I'm going to teach you that. And that's an easier selling proposition, but we're like ethically bound to saying no, not just as providers, but as patients,
So we know it doesn't work. Like, why am I gonna say I don't have the face to tell you, yes, you have to follow this diet and you'll be cured. I
Right.
I can't say it. Like my heart doesn't allow me to do that.
And
Otherwise, I'll be rich. I think I will have been rich by now, Cheryl, but I just can't.
I know. I can't. I don't want to put anyone on blast, but I do get so many inquiries of people trying to get onto the podcast to share their miracle thing. And I'm like, you obviously haven't listened to like a single episode. But anyway, do you have a favorite quote or inspirational saying for tough days?
Well, so I'll tell you when you talk to mental health, and I spend a lot of time. So I have my little mental health kind of journal, and whenever I have a quote, then I put it. So I just opened it, a random one, and I found it really cool and a really interesting one. So it's replace self-criticism with self-awareness and great commitment. Could I give up my addiction to suffering?
Oh,
Hmm.
That's thought-provoking.
Yeah. So is it that we have that sensation that, okay, I'm in pain, I want to be in pain, or maybe because I'm in pain, I have everybody's attention, or maybe I don't know. There was just something about that it really got me.
Hmm. That's awesome. Thank you for sharing. Yeah. Do you have a favorite arthritis gadget or tool in your toolbox, physical or metaphorical?
Oh, it really depends on what is going on. Like right now, I'm relying on my resting splints for
Mm-hmm.
doing everything has been in a lot of pain with my wrist, and also a reminder to use my finger
Silver ring splints.
silver rings and the plastic whenever. I think it's a reminder that sometimes I feel comfortable of living like this, but I have to remind myself that I need to also make sure that my joints remain functional
Yeah.
so I can, survive work.
Mm-hmm.
Mm.
Yeah, and if you're wondering how do you even know like which kind of splint might be right for you, then you can ask your doctor for a referral to a certified hand therapist, which is usually an
Mhm.
occupational therapist, sometimes a physical therapist with advanced training in the hand, and they could fit you for them and recommend what might work best for your body. So that's always helpful. Do you have a favorite book or movie or show you've consumed recently?
Oh, I was so happy to finally see adapted my favorite book to a mini series on Netflix, 100 Years of Solitude. It was by Gabriel Garcia Marquez.
Yes.
It was so beautiful to see. It was completely shot in Colombia with all Colombian actors in Spanish, all the fabrics, everything was made in
Oh
Colombia.
my
And
gosh.
that's what the author wanted, Gabriel Garcia Marquez. It's like, I don't want my book to be made into a movie, and he didn't want it, but somehow the sons managed to say, well, it has to be in Spanish, it has to be in Colombia, and it has to be with Colombian actors. And I think they did a beautiful, beautiful job doing that. And so I'm very happy I was very happy to see that.
That's awesome. Okay, I'm gonna check that out. And last question, what does it mean to you to live a good life and thrive with autoimmune disease or RA and Sjogren?
Wow. I thought about that and I came out with 5 C's.
Okay, awesome.
So I have commitment, consistency, compassion, courage, and credibility. Probably doesn't fit in there, but the way
Oh, I love that.
I light them out like that is a commitment. It's because when you are diagnosed, you truly need to be committed to life changes. See, be it lifestyle, be it treatment, but you need to be committed to that to make that conscious decision that is going to make me feel better. Consistent, because you need that consistency. If you stop your treatment, you're gonna feel pain. That's about it. If you make a lifestyle change, if you want to make changes to your diet, you need to be consistent on those habits to really see positive outcomes. Compassion is because we live with an unpredictable disease, and the only certain thing about living with autoimmune diseases is the uncertainty. That's the only thing that is certain. So when the treatment fails you, maybe that lifestyle that you maybe embarked or changed is not working, take your time and treat yourself with compassion because it's not your fault. But then you also need to have courage because it's so unpredictable. So many times you're going to feel that the treatment fails you and you kind of go back to ground zero. You don't want to do anything. And it's actually harder when you have felt maybe well for 2 or 3 years. And then all of a sudden a flare hits you. The treatment is not working for you. And you just feeling all this anger and disappointment. It takes a lot of courage to say, okay, I'm going to recommit. I'm going to try this treatment and I'm going to give myself another chance. And when it comes to credibility, is that you want to go back for reliable sources and reliable information. You want to collaborate with your team, starting with your rheumatologist, and then build that dream team that is going to help you, the occupational therapist, physiotherapist, registered dietitian, mental health therapist. It's built according to your needs. So those are my 5 C's: commitment, consistency, compassion, courage, and credibility.
I love that so much. I'm like a sucker for like an acronym or an alliteration. And my name is Cheryl Crow. CC is my initials. So I'm like, I love it. Keep going. Let's do the 10 C's. No, I love it. That's so great. Thank you. That's so thoughtful. And I know we have so much more to talk about. We were just talking about maybe doing a panel discussion at a different date, a panel episode on maybe obesity, because there's a lot of, just like nutrition, there's a lot of myths versus fact for that. But for today, if people are looking to find you online, where should they go?
So yeah, you can go to my website, arthritisdietitian.com. You can find me on Instagram at the Arthritis Dietitian, pretty much everywhere as Arthritis Dietitian. If you're looking for connecting with me in Spanish, I'm doing that more on TikTok at Arthritis Dietitian as well. But you also can find any of my collaborations with Arthritis Society Canada at arthritis.ca. And I've also done some work for the Sjogren Society of Canada. That's where you can find me.
Well, and I should say, because I am really have interesting spelling techniques, that dietitian is spelled like arthritis dietitian. We know how to spell arthritis, but Dietian. I usually put a C there. Don't put a C there. There's no C in dietitian. So
At least from Canada and England.
okay, I get confused. Okay, maybe that's why I get confused. But thank you so much. This has really been helpful. I always learn something or many somethings when I talk to you. And so I hope everyone follows, Cristina, get on her email newsletter list. I always read what she's sending, tons of helpful stuff. And we'll say bye-bye for now. Thank you so much for taking the time to chat with me today. We'll talk to you later.